Hi YouTube, my name is Michael Berenger. I'm a medical doctor and a full professor of sports medicine and exercise physiology at Goethe University, Frankfurt, Germany. Have you ever crushed a workout only to feel like you've been hit by a truck the next day? That is usually DOMS, the abbreviation for the delayed onset of muscle soreness. And yes, it's a mild form of muscle injury. According to the Munich consensus, it's classified as a functional muscle disorder. But if we are being precise, DOMS does involve structural damage just on a microscopic level. So what is DOMS exactly? Why does it happen? And most importantly, what should you actually do when you have it? Sit tight because this is your science-based recovery guide. DOMS, as I said, stands for the delayed onset of muscle soreness. The kind of muscle pain that usually sets in 12 to 48 hours after an intense and unfamiliar exercise, especially when it involves eccentric contractions. Think of scenarios like walking downhill slowly, lowering a heavy weight, or performing jumping movements. All of which emphasizes eccentric loading and places high mechanical stress on muscle and connective tissue. You might be wondering at some point, is this still just DOMS or could it be something more serious, like a muscle fiber tear? Here are a few signs that you can use that suggest it could be more than DOMS. The pain occurred suddenly during a specific movement, it's sharply localized rather than diffuse, and it may be accompanied by swelling or a visible bruising. While strength can also be reduced in DOMS, the loss tends to be more global and mild. In contrast, a tear often results in a sharp position-specific weakness, especially in loaded or stretched positions. If any of these apply, it's best to get it checked out professionally. DOMS builds up gradually and affects the muscle more diffusely, not as an acute pinpoint pain. Microscopically, DOMS is caused by a tiny structural disruption in muscle fibers, especially in the sarcomeres and Z-lines, and an inflammatory response in the surrounding connective tissue occurs. This inflammation is triggered by the release of damage-associated molecular patterns, abbreviated as DAMs. And those DAMs arise from the injured cell, which activate the immune response. As a result, immune cells like macrophages are recruited to the site, releasing pro-inflammatory substances such as cytokines that lead to pain, stiffness, and swelling. So importantly, DOMS is not a muscle tear. Rather, it is a structural disruption within the muscle fibers themselves on a microscopic level. And it can also affect the surrounding connective tissue. So why DOMS matters? Should we care? You might be wondering, can we just train through it? Well, that's a valid question. And while mild movement can actually help with recovery, training hard despite soreness can impair your mechanics, increase compensation, and elevate your risk of injury. So because DOMS doesn't just hurt, it directly impacts your ability to perform. After a bout of DOMS-inducing exercise, your muscle strength can remain reduced for up to 72 hours or even longer. At the same time, the range of motion is limited, proprioception and motor control are impaired, and the body often compensates with altered movement patterns to avoid discomfort. This is particularly problematic during movements that require higher levels of coordination, where even small deviations can significantly increase injury risk. These combined effects create a vulnerable period where the risk of secondary injury is increased, including muscle strains, joint overload, a chronic imbalance from poor biomechanics. That's why understanding and managing DOMS isn't just about easing discomfort. It's a critical part of injury prevention and maintaining training quality. While the theoretical basis for a link between DOMS and injury risk exists, well-controlled prospective studies specifically examining this relationship are lacking. Most sports medicine experts recommend allowing DOMS to resolve before returning to high-intensity training, and not because strong evidence shows a high injury risk, but to stay on the safe side given the plausible theoretical link between both things. Let's start with the things you should avoid when you're experiencing DOMS. First, don't push through a hard training session just because you think soreness equals progress. In fact, there's no strong evidence that experiencing DOMS is necessary for hypertrophy or strength gains. This is a common gym myth, so to say. While DOMS may occur alongside effective training, it's not a reliable indicator of progress. And training under significant soreness increases your risk for compensatory movements and then secondary injuries. Second, be cautious with over-the-counter painkillers like non-steroidal anti-inflammatory drugs. While they may reduce discomfort in the short term, there is evidence that they can interfere with muscle adaptation processes, especially if used frequently, although the exact biological mechanism still remain unclear. A study published in 2023 showed that even over-the-counter doses of ibuprofen may blunt muscle hypertrophy, though the mechanisms are still not fully understood. And third, while complete rest might seem like a good idea, staying entirely inactive for too long could slow down recovery. Direct evidence is limited, but from a physiological standpoint, low-intensity movement appears beneficial. It promotes circulation, supports metabolic clearance, and helps preserve mobility. So now let's look at what actually helps when DOMS hits. First of all, it is active recovery. The most important intervention is gentle movement, low-intensity aerobic activity that increases the circulation, which helps clear out metabolic waste products and promotes tissue repair. Good options include, for example, cycling, easy cycling, light swimming, or even going for a walk. These activities, they improve recovery without adding further mechanical stress to the muscle. Second, sleep and nutrition. Your body recovers best when it's well rested and well nourished. Aim for about 7 to 9 hours of quality sleep per night, especially after intense training sessions. Nutritionally, prioritize protein intake and include anti-inflammatory food like berries, fatty fish, olive oil, and turmeric in your diet. These support both muscle repair and control of the inflammatory response. Third, recovery tools. A recent umbrella review synthesized data from nearly 900 randomized controlled trials on physical therapies for DOMS. Despite major variability in the study quality, some interventions showed consistent pain-relieving effects at specific time points. Immediately after exercise, contrast therapy. That showed the strongest evidence for short-term relief. 24 hours after that, more massage and cooling therapies are effective. They showed small to moderate effects. 48 to 72 hours after it, compression garments, kinesiotaping, phototherapy, or cryostimulation may help, though most effects were modest and based on lower quality studies. Overall, massage, cold-based therapies, and contrast therapy stand out as the most promising, but should be combined with realistic expectations and awarenesses of the mixed evidence quality. Then fourth is the load management. When dealing with DOMS, adjusting your training load is key. Reduce both intensity and volume temporarily and shift focus to unaffected muscle groups or technique-based training. Avoid exercises that provoke sharp pain and give priority to controlled movement and quality execution. What about prevention? Can you really prevent DOMS entirely? Not really. But you can reduce its severity and duration by approaching your training strategically. So first of all is the progressive overload. Build up training volume and intensity gradually, especially when introducing eccentric heavy exercise. Sudden jumps in workload are a common trigger for DOMS. Repeated bout effect. Once your muscles have been exposed to a specific eccentric stress, they adapt, and future exposures produce less soreness. This is called the repeated bout effect, and if you want a deeper dive into this phenomenon, check out our dedicated video on the repeated bout effect here on the channel. Then there is monitoring the training load as the third component. Track volume, intensity, and recovery markers. A training diary or app can help to avoid overreaching and allow for smart progression. So in summary, DOMS is a normal response to training, especially when pushing into new territory, so to say. But soreness is not a badge of honor. It's a signal, and how you respond to it matters. It's worth noting, while DOMS can theoretically increase injury risk due to altered movement control, the evidence is far from clear. High-quality studies are lacking, and any risk likely comes from indirect effects, like compensating through fatigue or poor technique. That's why it's generally wise to wait until soreness subsides before returning to full intensity. If you found this helpful, subscribe for more evidence-based sports medicine content and let me know in the comments how you deal with the DOMS. See you soon. Bye-bye.